We all are sad sometimes. We all are obsessive sometimes. We all are anxious sometimes. It's when these things are taken to the degree that they interrupt our ability to function that they then are called a disorder.
Major mental illnesses rarely occur out of the blue. There might be some early signs that something's going on. One of those signs is social withdrawal. So people that are feeling less engaged with their friends and their family members might be a sign. Other signs might be specific to whatever that illness might be, feeling particularly low in a way that you're just not used to, or feeling incredibly anxious in a way that just feels very different than being a little bit worried like you're used to feeling.
One could also notice changes in their sleep patterns, changes to their physical symptoms. They might become more symptomatic in terms of stomach aches, headaches, chest pains.
So one of the hallmark kind of time frames are things lasting for 2 weeks or more. If it's a few days, you're having an off time, it could be for a lot of different things. If something is lasting for 2 weeks or more, it's really important to recognize that, ask for help, reach out to your doctor, talk to your partner, whomever, and see where you can get some support.
The earlier you can identify these things, the more quickly you can get treatment and the more you can alter the patterns for that person's life. Because the longer a mental illness goes on, the more entrenched those patterns get and the more difficult it is to unwind them.
The wiring in the brain that was initially rarely traveled, a country road, let's say, just traveled once or traveled twice and stayed small, with repetition, like a truck driving down that country road, makes it bigger and wider until it becomes ultimately a superhighway. And then it's very easy to travel that road, and so people tend to relapse if they either don't get treated and it goes on a long time, or they continue to have episodes untreated.
So when you have a family history of any kind of mental illness, you're probably going to be a little more on top of whether or not you yourself might be experiencing some of those very same symptoms. The good thing is that you know what these symptoms look like because you've seen them before. Because mental illness is genetically based, there's not a lot you can do to prevent the illness, but there's a lot you can do to prevent the severity of the illness. So making sure that you know what the signs are and getting help when you see those signs is the best thing you can do.
If you're having thoughts of suicide, get support. Call a Suicide and Crisis Lifeline at 988.